My name's Sophie Scott. I'm the medical reporter for ABC. Welcome everyone on behalf of the Australian Commission on Quality and Safety in Healthcare. I'd like to welcome you to the launch of the National Delirium Clinical Care Standard. Before we start today, I'd like to acknowledge the traditional owners of the land on which we meet, the Bidjigal people of the Eora Nation, and pay my respects to their elders past and present. So we're delighted to have a number of important speakers today. Professor Phyllis Marshall, Chair of the Board of the Australian Commission on Quality and Safety in Healthcare, Associate Professor Gideon Kaplan, Director of the Post-Acute Care Services and Geriatric Medicine at Prince of Wales, and he's the Chair of the Delirium Clinical Care Standards Working Group. We have Joan Jackson, who's a consumer representative on the same group, and she was the carer for her late husband Michael, who suffered from delirium. So we're delighted to have her here today. And Dr. Carolyn Hullock, an emergency physician from John Hunter and Belmont Hospitals. And last but not least, I'd like to thank all of you who are at the conference for coming down and spending the time with us today to learn about these important new standards. So thank you very much. As I'm sure all of you know, that the statistics about delirium really are concerning. I was really quite shocked when I did the research into delirium as part of preparing for today, that 10% of Australians aged 70 or older have delirium when they're admitted to hospital. And intensive care, it could be up to 50% of patients that have it. So those are really high statistics. But despite that, the detection is poor and most cases are missed. And the burden of delirium is so high also from what I read. It can be a frightening and isolating experience. There's an increased risk of death, an increased length of stay in hospital, increased risk of falls. And so that's why these new clinical care standards are just so important, to turn some of those statistics around. And these standards will ensure that patients get the best treatment no matter where they are in Australia.